The people that you see on your screens are the ones who've lost their lives due to a tragedy that could have been averted, simply by testing the water that was being circulated in the area. In late December 2025, residents of Bhagirathpura in Indore began noticing that their tap water was discolored, foul-smelling and bitter. But despite repeated complaints to civic officials, the supply continued. By December 27 or 28, people drinking this water started developing vomiting, severe diarrhea, dehydration and weakness. And as the days passed, the number of cases surged sharply, with hospital admissions rising above 100 by December 30 and multiple deaths reported by the 31st of December. Laboratory tests have confirmed that the municipal water supply was contaminated, believed to be due to sewage mixing with potable water. What the cleanest city of India now faces is a massive health crisis that has affected the lives of more than 149 people and completely altered the course of 9 families. Hello and welcome to Deep Dive by NewsX, and I'm Vaishali Kohli. Today we talk about those 9 families whose normal lives were torn to pieces after drinking heavily contaminated water. Let's start with the youngest victim of the tragedy. Tragedy cuts deeper with the loss of Avyan Sahu, just 6 months old. The youngest known victim, too fragile to withstand severe dehydration and infection. The infant succumbed as cases surged across the locality. Speaking about his son's death, all one could trace of the defeat on the father's face as he explained a series of unfortunate events that led to his losing his little baby. Listen in.
बालों को दस्त लगे हुए थे, बुखार आ रहा था, उसको डॉक्टर को हमने दिखाया था। चाइल्ड स्पेशलिस्ट डॉक्टर है, उन्होंने मेडिसिन लिख के दे दी थी, हम घर ले आए थे उसको। तो ये 26 तारीख को दिखाया था हमने। 2 दिन ठीक रहा बच्चा, मतलब ठीक है। अब दस्त लगे तो नर्वस तो होता ही है बच्चा थोड़ा, ये सोच के हमने ठीक है मंडे को दिखा देंगे। रात को अचानक एकदम उसको तेज़ बुखार आया, उल्टी हुई उसको और वही घर पे हो गया वो। घर पे शांत हो गया था।
कितनी तारीख को?
29 तारीख को।
कितने साल बाद आपके वहाँ औलाद हुई थी?
The next victim was Uma Kori, just 29 years old. Reportedly, her health deteriorated so quickly that doctors had little time to stabilize her before she passed away. Seema Prajapati and Gomti Rawat, both 50-year-old middle-aged women managing households, also fell ill within hours of consuming the contaminated water and died shortly after. Their families recounted ordinary days turning fatal as routine chores like cooking or feeding children became unknowledgingly lethal due to tainted supply lines. The victims of the Indore contaminated water tragedy span generations, revealing how incriminate and devastating the crisis has been. Nandlal Pal and Urmila Yadav were among the elderly residents who fell violently ill after drinking what they believed was safe municipal water. All 2 developed acute vomiting and diarrhea, symptoms that escalated rapidly despite hospitalization. Recounting her father's death, Sudpal, daughter of Nandlal Pal, said he passed away on December 30th, purely due to diarrhea and vomiting. Let's listen in.
पापा का निधन हुआ है, 30 तारीख को हुआ है। वो 10 उल्टी के द्वारा गए हैं। उन्हें कोई हार्ट अटैक कोई कुछ नहीं आया है, सिर्फ वो 10 उल्टी की वजह से ज़्यादा से वो जब भी 2-3 दिन बीमार रही, फिर हमने तुरंत उनको हॉस्पिटल भर्ती करा, जिसमें वो उनकी हालत इतनी डाउन थी कि वो अपने आप से मतलब खड़े ही नहीं हो पा रहे थे। और हमने इतने डायपर बदले उनके कि हद से ज़्यादा।
कितनी उम्र थी उनकी?
उनकी उम्र ऐसे तो 76 है, पर जो बता रहे थे अपने मुंह से वो 70 का बता।
Amongst the elderly who unfortunately passed away, one of the deceased was a 74-year-old Manjulata Digambar Vade. The 74-year-old victim was admitted to the hospital after she suddenly started suffering from acute vomiting and diarrhea. The family rushed to the hospital, where she died during treatment early in the morning. Look at her husband's teary eyes when he details the ordeal. Let's listen in.
शांत हो गई। अचानक 11 बजे रात से उसकी तबीयत बिगड़ गई। उल्टी दस्त इतने हो रहे थे कि पूछो मत आप। मैं परेशान हो गया कि इतने उल्टी दस्त अचानक एकदम से कैसे हो गए इसको। वो चक्कर भी इतने बहुत आए कि उठ बैठ भी नहीं पा रही। चाय पिलाऊं तो वो भी उल्टी हो जाए। कुछ खाने की तो उसकी इच्छा ही नहीं हुई, क्योंकि जो भी खाए वो सब उल्टी हो जाती थी उसको। क्या नाम है उनका? उनका मंजुला वाडे नाम है। 74 साल की उम्र।
Tara Kori, around 65, is listed as another casualty. Santosh Begolia too is among those whose deaths are under investigation, reflecting the uncertainty families continue to live with as authorities verify links to the outbreak. Together, these 9 stories expose not just a health emergency, but a failure of basic civic safeguards, where contaminated water moves silently through homes, leaving grief that statistics alone cannot capture. For the families who's lost parents, daughters, and even an infant, there will be no return to normal, only unanswered questions. As probes continue and officials trade explanations, one reality remains unaltered. This crisis was preventable, and unless accountability is fixed, infrastructure repaired, and vigilance restored, the fear is that Bhagirathpura may not be the last neighborhood forced to learn that neglect can be just as deadly as disease. I have my guest joining me on the broadcast, Rashmi Samant, author and activist, former SU President, University of Oxford. Rashmi, just looking at the people's relatives who've lost their lives in this very, very tragic thing that has happened in Indore is absolutely heartbreaking. Very unfortunate, a tragedy that surely could have been averted. What would you like to say?
Well, I completely agree with you. This was definitely a man-made disaster. It was due to gross negligence of the administration in Indore that these people are losing their lives, and it's inadvertently affecting, some of the sensitive parts of our society. It's affecting kids and the elderly, and that's absolutely heartbreaking. This deserves more outrage. I think everybody should be outraged, and I call for people responsible for this to be fired, because they do not deserve to be in any sort of public office. So the officers, the administrators who are responsible for this should face the consequences of this disaster, and it shouldn't be dealt with lightly. There should be a higher level inquiry, and all those who contributed to this sort of lapse, which could have completely been avoided, have to be held to account.
You know, Rashmi, this is very scary because now this has happened in Indore. This could happen anywhere, and any of us could be affected with this tragedy, which makes it scary. But what makes a person really angry is that, people were complaining about this to the authorities and nothing really was done initially. What would you like to say on that?
Well, I think I am outraged, and it's absolutely pathetic, and I think it's a lapse on the part of the authorities, plain as day, and they need to be held accountable. And I think the people on their part, of course, they did feel helpless. It reminds me of the days of the Bhopal gas tragedy. Although I wasn't around, I've read quite extensively about it, about how there were social activists constantly writing about the tragedy waiting to happen, that Bhopal was sitting on a ticking time bomb, but the authorities turned a blind eye to that. I think this whole race of being developed, of developing our city, should come with equal responsibility towards our environment, so that such tragedies do not happen. I think it's something that we are missing on right now, and these tragedies, they show light on, that kind of irresponsibility, that kind of lapse, and it's history repeating itself in many ways. Although it's not the same scale, I think every life lost is. I think it's it's equally precious. You just cannot put a price on life being lost. So I think it's absolutely heartbreaking, and that this could have been averted, and that the authorities have to be more vigilant. If not anything, I feel that the people need to make it a point that anywhere else across the country that this sort of thing does not repeat. That the outrage against the authority should be that to that extent.
And Rashmi, we've mentioned all age groups, but we've spoken about a 6-month-old child. And it's absolutely heartbreaking to even report on these things. It's very, very, very unfortunate. Now, my question is that, how do successful cities, how do premier top tier cities ensure that citizen complaints translate into urgent health action by the authorities?
Well, I mean, I have a master's in in sustainability. I've studied this deeply. I'm studying this in my PhD as well. It's happened across the world. It's not isolated to India. I think in the upper lake somewhere in Canada there was a discharge of metal tailings, which led to widespread death of people because of cancer that they developed from drinking that water. And this sort of public health emergency, it's happened in different parts of the world, and the judiciary to some extent has been efficient in awarding comparable awards to people. They've to the extent that it's bankrupted these authorities who were responsible for these tragedies, the private companies that did the discarding, etc., etc. They were actually run to the ground because of the compensation that the judiciary offered as a result of that. So I think the judiciary really needs to step in and play the role of showing consequences to actions. I think there needs to be a deeper investigation. This is clearly a case of irresponsible discarding by many actors, which could be even private to the extent. And I think the judiciary really needs to send out a strong message with the compensation, with the kind of holding to task the people responsible. Only then can a precedent be set in such a manner that people are not irresponsible on any level, be it the administration or private actors who inadvertently contribute to this. Across the world, such tragedies do happen. It's very unfortunate when it happens. Kids and the elderly are especially the ones who are most affected. It's extremely heartbreaking to even read about it, and the long-term impacts of such kind of contamination is still unknown, because such contamination, it works in a very slow and in a slow way, wherein there is multi-generational effect as well. So I think it's time for the judiciary to step in, and that's how it's done across the world, and they set a precedent with their landmark judgments. So I think that's the need of the hour right now.
Rashmi, the point also is that it's damaged, this incident, this has completely damaged trust in municipal health systems. Today, when I go home and drink a glass of water, it is going to strike me that, am I even drinking safe water or not? So that stays in the mind. What would you like to say on that?
It's definitely scary times. I have nothing to say. I think that fear is valid, and I think it's up to the authorities to make sure that it reassures the people in such a way that this worry is not the first thing on their mind. And I mean, yes, it's a valid fear, and I think everybody across the nation today echoes that fear.
Rashmi, we were talking earlier about other countries, other places where something like this does happen. But, just to talk to you about global public health frameworks. Now, when we talk about that, where does accountability lie when early warning signs are ignored?
Well, I think early warning signs are ignored in almost most cases. Unfortunately, in human, societies without consequences, there's rarely any action. be it here or across the world. And I think as citizens, we need to collectively raise this through media, through citizen collectives, to change that for the better and leave an exemplary system that the rest of the world can also follow. The discarding of tailings, be it in the upper lake or the lower lake, between the Canadian and American borders, were not unknown to people. People did raise it with local authorities, but it's only after people died a decade later, and there was a class action suit that the kin of the victims then went to court with, and there was a heavy settlement paid a couple of years after that. This situation was not brought to light, and it wasn't dealt with the seriousness that it should have been dealt with to begin with. So I think that framework is definitely lacking. Consumerism, capitalism has unfortunately put human health and public health at the back seat in different parts of the world. And there needs to be more innovation, there needs to be more study, and there needs to be more sensitivity in the way that we deal with this.
Absolutely, Rashmi. What a glass of water has done in Indore is absolutely unimaginable. Thank you for joining me, Rashmi. And with that, we're slipping into a short commercial break. We'll be back shortly.